approved in other countries for the treatment of stress urinary incontinence. Stress incontinence is when you have leakage of urine from the bladder in little spurts, usually because of a sneeze or a cough. You see it really in women, particularly postmenopausal women that have had children, maybe. There's a weakening of the pelvic floor muscles. Kegel exercises are the ones that are recommended to do for improvement of muscular tone and to improve stress urinary incontinence. But you could also give anticholinergic medication. Anticholinergic medication tends to increase the bladder tone, and actually it makes it more difficult to empty the bladder. And so Cymbalta does this through epinephrine's actions on acetylcholine. So it's actually the increase in norepinephrine, which is a major neurotransmitter for the sympathetic nervous system, the fight or flight nervous system, that tends to inhibit acetylcholine. So you get a relative anticholinergic action. And when acetylcholine can't act on the level of the bladder, you get increased bladder tone. It's harder for the bladder to relax, and you get urinary retention as a side effect, which can be a real problem, particularly in the elderly. But in patients with stress urinary incontinence, it's a nice and convenient antidote. So it's not approved for that in the United States, but it is used quite a bit off-label for that. And again, other countries, you do see that indication. When the body releases those chemicals, the last thing you want to do is take a break from your escape route. And so it just makes sense that norepinephrine is going to inhibit acetylcholine, which is going to inhibit bowel movements and emptying your bladder. And so again, urinary retention is a potential side effect, or it's something maybe that we could exploit, an effect that is welcome if it's moderate. It is dose dependent, but if it's just a little bit of that, it can help with stress incontinence, urinary stress incontinence, when we sneeze or cough.